So I get asked by my friends and family, how's work? And I never really know how to answer.
A lot of us are working overtime, several shifts a week, just to be able to take care of the volume of patients that we have in the ICU right now. It kind of weighs heavy on you to know that at this point, even when our ICUs are full, we are struggling.
So today is actually a good day, but it's a good and a bad day. The good day is that we're at work and we're busy, we're all healthy, but we're also starting to see our numbers go up. And seeing these numbers go up, we're just trying to figure out, okay, has it come to a point where resiliency is not there now? Because we do realize that with Memorial Day weekend and also with the peaceful protest that's been going on, we definitely do understand why, but there's no social distancing. But then also, there's no, people are not wearing the masks.
It's been really emotionally distressing. Seeing these young people get sick with families and these lives left to live.
We live in a constant state of fear for ourselves, for our family members, for our coworkers.
I think politicians are not really doing a good job in letting the public know how tough things are. A lot of the nurses are working so much. We miss our kids.
Starting this week today, even though last week was my attitude for gratitude, this week I'm focusing on, okay, we're running a marathon, we're almost there, and it's gonna be okay, one day at a time. Pace yourself, and we'll get there together.
Another 1.5 million Americans filed for unemployment last week, the 13th week in a row that weekly jobless claims were in the millions. NBC News senior business correspondent Stephanie Rule runs through today's numbers.
The weekly jobless claims report is in 1.5 million more people. We're now well over 40 million people in the last 12 weeks, but 1.5 million people filed for unemployment in the last week. Why is this important? Well, A, that's a whole lot of people, but B, the number is higher than was expected. Analysts were expecting 1.3 million. And remember, since the country has been reopening, we have seen the number go down, go down, go down. In the beginning of the state closures, we saw massive layoffs. That made sense. We shut down every business. But now, virtually every state across the country is going through some level of reopening, so we are seeing the job loss numbers go down. The fact that they're going up this week is concerning. It's also concerning that in some states like Texas, where we've already seen pretty broad-based reopening, we're starting to see some businesses, restaurants, have to close again. And they're having to close again because the coronavirus cases are spiking in over 20 states. So please remember, the jobless numbers are directly tied to COVID. And for many of those businesses out there, if they're forced to shut down again, there's a chance they won't survive. And these expanded unemployment benefits, that's what people are receiving now, while they are a big positive, they're a reason you're seeing consumers go out there and spend, they run out at the end of next month. And many Republicans have said they don't want to see these benefits extended because there's a lot of people who are unwilling to go back to work because they're making so much money. Well, that argument doesn't hold very much water because many of those people aren't going back to work, A, over health concerns, and B, because they don't have any child care. We still don't have schools and other programs open. So while 1.5 million is still going down, it's a very big number. And anyone who thinks the economy is roaring right back, it's certainly not roaring, it's slowly climbing.
Beijing's latest COVID-19 outbreak is now under control, according to Chinese health experts. Now they're working on balancing containment and recovery as they investigate what caused that spike. NBC News foreign correspondent Janice Mackey-Freyer reports.
Allison, authorities here announced today that they figure the outbreak is contained, but it doesn't mean the restrictions that they've imposed over the past few days are going to go away anytime soon. And if anything, they're being expanded. They added another 21 cases today, so the total of this outbreak is 158. They are going to continue doing wide-scale testing. As of yesterday, they've tested 356,000 people. They have the capacity to do even more on a daily basis. And restaurants have been ordered to shut down for as long as they have to ensure that every single worker they employ gets tested, even if their establishment is at the other end of the city from the wholesale market. And that's because this market supplies roughly 80% of Beijing's food, meat, produce, and seafood. And seafood is where investigators are zeroing in on, because environmental samples that were taken at the market showed that cutting boards and counters had returned a positive result for the virus. They also said that seafood vendors who got sick showed symptoms earlier than other vendors who got sick. But the recovery that had been underway here is now pretty much upended. Schools are closed again. There are restrictions on travel, on eating out, on going to a museum. You can't take a bus out of the city, and more than 1,300 flights were canceled. If it's necessary for you to travel, you have to do a lot of things. First, you need to show a green health code in your phone that would prove that you don't live in what's been deemed a high-risk neighborhood in Beijing. You have to take a COVID-19 test and prove that you are testing negative. And you also have to be prepared to face quarantine wherever it is that you're going. So it's not a total lockdown, but it's definitely a step back from where we were even a week ago, which was arriving at a place that might be the new normal, where we could move between cities again, and the economy was showing signs of revival. The emergency level in Beijing that had been lowered a couple of weeks ago was raised again yesterday. So maybe what's happening here can provide a look into the not-so-distant future for any cities or states that are looking to reopen. This is a pattern that we're seeing in countries across Asia, in Japan, South Korea, in Singapore, where restrictions are lifted, there's an uptick in cases, and the restrictions return. Repeat. Chinese officials say that it's a cycle that we all have to get used to.
Arizona's governor making a U-turn, issuing an executive order on masks as coronavirus cases spike in the state.
Every Arizonan should wear a face mask, so the Department of Health Services is updating its guidance. It will strengthen measures that will protect employees, customers, and patrons of these establishments. And if they don't, there will be enforcement, and they will be held accountable.
NBC News reporter Vaughn Hilliard joining me now from Phoenix. And Vaughn, the governor changing his coronavirus policy pretty dramatically since you spoke with him a couple of weeks ago. Take us through the then and now.
This was a governor that was quite defiant over the course of this last month, Allison, since he decided in early May to begin allowing restaurants and retail to open. And then on May 12th, his announcement that he would allow the state's stay-at-home order to expire. It was on May 12th in which he said, quote, "We are clearly on the other side of this pandemic." As the last month has shown us, that was far from being the case. There was even indication at the time that the numbers were continuing to increase, but this was a governor that was eager to allow businesses to begin reopening, allow employees to return to their place of work. And what you saw, though, was a steady rise over the course of 3 weeks that led us here to today. Today, more than 2,500 new cases, the highest mark of hospitalizations yet in the state, and the most number of ICU beds in use. 32 more Arizonans have died as well in the last 24 hours. This is the reality that the governor was met with. And that's why I want to let you hear from him on June 4th and then hear from him yesterday. Take a listen.
We are not in a crisis situation. If that were to happen, we have available field hospital capacity, along with the Army Corps of Engineers and the National Guard. So if something were to go in a dramatically elevated position, we'd be prepared in Arizona. And there is indication that we are not out of the woods. The last 2 weeks of data, there is a trend, and the trend is headed in the wrong direction. and the actions that we're going to take are intended to change that direction and reverse this trend.
Allison, you saw what happened over the course of those 2 weeks. You know, the governor got a lot of pushback for his suggestion that there was enough hospital bed capacity. Essentially, that the hospitals had not been overrun, even though even at that time, there were still hospitals. At 11, I believe it was there around that June 4th period, that had already told me that they had hit ICU bed capacity. But then there was this idea that, well, hey, you know, we can send patients over to other hospitals. But that's where you saw the pressure became too much over the course of these last 2 weeks, especially as more than 11,000 new cases reported over the last week, in which it finally was the time for the governor to address this, Allison.
Vaughn, Governor Ducey is bringing in 300 members of the National Guard as well. Do we know specifically what they'll be doing?
Yeah, the National Guardsmen have been called into duty in order to be part of a contact tracing effort here. You know, this is the part of where is the spread. You've heard of local businesses that have had multiple employees test positive. Of course, the nursing homes and prisons. But where are these points? You know, we're talking about the 5th largest city here, just Phoenix alone in the country, not to mention the surrounding metropolitan areas. And that's what those 300 National Guardsmen, according to the governor, have been brought into. The governor also, as part of his executive order, is allowing localities to take charge of, in terms of placing their own mask requirements. The likes of Tucson and Flagstaff have already made this order. This afternoon, the city of Phoenix, the city council will be voting on their own measure, because what you had seen is from coffee shops to retail to restaurants, folks were hardly wearing masks here. You know, it was 2 weekends ago, I walked into my favorite coffee shop right here off of Central Avenue, Allison, and just 4 of us out of 67 people that walked in over a course of a 10-minute time had masks. And that's where you saw a lot of the outcry from these local localities was saying, we need, in order to have the ability to be able to enforce mask wearing on our residents. And the governor also gave them enforcement authorization, and he also provided localities as well as state agencies the ability to enforce CDC guidelines being adhered to within businesses. Because as I said, there were a lot of restaurants, a lot of retail where it looked like it was back in June of 2019, not June 2020. And now he's saying that there will be ramped up enforcement on these very businesses that are not enforcing their patrons to adhere to social distancing and other CDC guidelines. Allison.
Vaughn, you've been mentioning some of the small businesses in the Phoenix area. Some of them are taking their own precautions to try to prevent the spread of the virus. I know you talked with a chef at a local restaurant. What did he tell you? What's he doing?
Yeah, take a listen. I'll just let you hear directly from him. This is Tom D'Ambrosio of AIOLI's Gourmet Burgers. And we just met up with him, and I'll let you hear directly from him, because this is the situation that a lot of these local businesses back in March and April were dealing with, is how do you keep your patrons safe while also making sure you can still run your business? Take a listen to our conversation with Tom.
We decided to close our in-room dining. We still are available for curbside pickup. You can also eat on the patio. Our big reason for doing this is the spike in numbers recently in Arizona, and to see what has happened in other restaurants across our state, how they've had outbreaks. You know, our big thing was, let's be ahead of this. You know, let's be proactive instead of reactive.
You know, that's what you heard from Tom there. He's taking that measure because he says, look, we're a local business that is a part of our community. At the same time, the AIOLI family own a popular deli in North Phoenix, and they announced just yesterday, telling me that they're going to be closing here for the indefinite future because of such the reliance on indoor dining. This is the tough part here, is that there was such a desire to reopen the Arizona economy. Yet the question is, did it happen too soon? And even if you go back and look at those past question marks, now where does the state go from here? Because here in Arizona, we're still in our first wave. There's been no conversation yet about what could potentially come up in a second wave. Allison.
All right, we'll have to see. Vaughn Hilliard in Arizona, thank you so much.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here. And click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.